Okay, chapter 1. I'm going to finish the rest of this chapter. Nursing Assistant Care, the Basics by Hartmans. I'm going to begin where I last left off. Okay, so a very important part of protecting residents' rights is preventing abuse and neglect. Abuse is purposeful mistreatment and causes physical, mental, emotional pain and injury to someone. There are many forms of abuse, including the following: physical abuse in any treatment, intentional or not, that causes harm on the person's body. This includes slapping, bruising, cutting, burning, physically restraining, pushing, shoving, or even rough handling. Psychological abuse is emotional abuse caused by threatening, scaring, humiliating, intimidating, isolating, or insulting a person or treating an adult as a child. Verbal abuse is the use of spoken or written words, pictures, or gestures that threaten, embarrasses, or insult a person. Sexual abuse is non-consensual sexual contact of any type. Financial abuse is an improper or illegal use of any person's money, possessions, property, or other assets. Assault is a threat to harm a person, resulting in person feeling fearful that will be harmed. Telling a resident that she will be slapped if she doesn't stop yelling is an example of assault. Battery is an intentional touching of a person without their consent. An example is an NA hitting or pushing a patient or resident, which is also considered physical abuse. Forcing a resident to eat a meal is another example of a battery. Domestic violence is an abuse by spouses, intimate partners, family members. It could be physical, sexual, emotional. The victim can be an adult or a child. False imprisonment is an unlawful restraint that affects a person's freedom or movement, both the threat of being physically restrained and actually being physically restrained. Any types of false imprisonment. Not allowing a resident to leave the facility is also considered false imprisonment. Involuntary seclusion is a separation of a person from others against a person's will. An example of an inmate confining a resident in his room. Workplace violence is abuse staff by others, staff members, residents, or other visitors. It can also be verbal, physical, sexual, that includes improper touching and discussion about sexual subjects. Sexual harassment is unwelcome sexual advance or behavior that creates an intimidating, hostile, or offensive working environment. Requests for sexual favors and wanting, touching, or other acts of sexual nature are examples of sexual harassment. Substance abuse is a repeated use of illegal drugs, cigarettes, alcohol in ways that harms one itself of others. For an NA, substance abuse can lead to unsafe practices that result into negligence, malpractice, neglect, and abuse. It can also lead to loss of NA's job. Neglect, a failure to provide care that results physical, mental, or emotional harm to a person. Examples: leaving a bedridden resident along with for a long period of time or denying residents food, dentures, or eyeglasses. Negligence means failure to act or provide proper care for a resident, resulting in an unintended injury. An example of negligence is an NA forgetting to lock resident's wheelchair before transferring her. The residents then fall and injure. Malpractice occurs when a person is injured due to professional misconduct through negligence, carelessness, or lack of skill. Nursing assistants must never abuse residents in any way. They must also try to protect residents from others who abuse them. In an NA season, a suspect suspects that another caregiver, family member, or resident abusing a resident, she must report this immediately to a charge nurse. Reporting a suspected abuse is not optional; it is the law. Observing and reporting abuse and neglect. The following injuries are considered suspicious and should be reported: poisoning, traumatic injury, teeth marks, belt buckle, strap marks, bruises, contusions, welts, scars, fractures, dislocations, burns or unusual shape of unusual location, or cigarette burns. Scalding burns, scratches, and puncture wounds, scalp tenderness or patches of a missing hair, swelling in the face, broken teeth, nasal discharge, bruising, bleeding, discharge from the vaginal area. These signs could indicate abuse, yelling, obscenities, fear, apprehension of fear of being alone, poor self-control, constant pain, threatening to hurt others, withdrawal, or apathy. Alcohol or drug abuse, agitation, anxiety, or just signs of stress, low self-esteem. Mood changes, confusion, disorientation, private conversations are not allowed or family members, caregiver present during all conversations. Reports of questionable care by the resident or her family. These signs could indicate neglect, pressure injuries, unclean body, body lice, unanswered call lights, soiled bedding, incontinence briefs not being changed, poor fitting clothing, unmet needs relating to hearing aids, eyeglasses, weight loss, poor appetite, uneaten food, dehydration, freshwater beverages are not being offered regularly, resident reports not receiving prescribed medication. Nursing assistants are also in an excellent position to observe and report neglect and abuse. NAs have an unethical legal responsibility to observe for signs of abuse and report suspected cases of proper person. NAs must follow the chain of command when reporting abuse. If action is not taken, the NA should be reporting it up to the chain of command until action is taken. If no action is taken to the facility level, he can call state abuse hotline or contact proper state agency. Abuse could be reported anonymously if a life and death situation is witnessed. The NA should be remove the resident into a safe place if possible. The NA should get immediate help. To have go for some help, the resident must not be left alone. Okay. So, nursing assistants are also excellent position to observe and report abuse or neglect. NAs have an unethical legal responsibility to observe for signs of abuse or report suspected cases to a proper person. NAs must also follow the chain of command who's reporting abuse. If action is not taken, the NA should keep reporting up the chain of command until action is taken. If no action is taken at facility level, she can call the state abuse hotline or contact the proper state agency. Abuse can be reported anonymously if a life death situation is witnessed. The NAs should be removed. Remove the resident into a safe place if possible. The NA should get help immediately or have someone go for help. The resident should not be left alone. If abuse is suspected or observed, the NA should give the nurse as much information as possible. If residents want to make complaint of abuse, NAs must help them in every way. This includes telling about the process and of their rights. The NAs must have the retaliate against punish. Patients complaining of abuse. If NAs seeing someone being cruel or abusive to a patient who has a complaint, she must report it. All care team members are responsible for resident safety should take her responsibility seriously. In long-term care facilities in the United States, an ombudsman is assigned by law of legal advocate for patients. The Older Americans Act, OAA, is a federal law that requires all states to have an ombudsman program. Ombudsman visit facilities and listens to residents. They decide what action to take if there are problems. Ombudsman can help resolve conflicts and settle disputes concerning residents' health, safety, welfare, and rights. They gather information to try to resolve patients' problems. Ombudsmen provide an ongoing presence at care facilities. They monitor care and conditions. An ombudsman is a legal advocate for patients. She visits the facility and listens to residents and may work with other agencies to resolve complaints. Okay, everyone, I will be continuing in Chapter 1 for nursing assistant care. What I'm reading so far to help me to pass my test and to understand regulations of nursing. I'll continue on later. Have a good one, everybody. Bye-bye.